Welcome to today's GNCC Espresso Live with our distinguished guest, the Acting Medical Officer of Health for Niagara Region, Dr. Hirji. Dr. Hirji, thank you so very much for being with us. My name is Mishka Balsam and I will be your moderator for the next hour. One of GNCC's guiding principles has been our commitment to being data-driven and evidence-based so that we as an organization can make well-informed decisions and hopefully assist businesses and individuals to do the same. It is with that in mind that we deeply appreciate having Dr. Hirji join us on a monthly basis for our Espresso Live. Organizations and governments are continuously responding to the ever-changing pandemic situation and its impact on our community, on our life, on our family, and our organizations. Businesses are committed to keeping employees, customers, and suppliers safe while at the same time planning and being prepared for what lies ahead. And to do so effectively, information is critical. Often in advance of this Espresso series, you, our audience, provide us with questions and we are committed to getting to all of them. But starting out, Dr. Hirji will provide us with an update, which will be directly followed with an interactive question and answer session. If you are interested in enabling live transcript, please refer to the bottom of your Zoom screen for that option. And if you have any questions or any technical difficulties, please utilize the chat function and we will get right back to you and hopefully we'll be able to assist you. And on that note, I'm going to move the webinar over to you, Dr. Hirji, for an overview.
Great, thank you so much, Mishka, and thanks to the GNCC for once again hosting me here. I will try and actually, and thanks to everybody for submitting questions in advance, I'm going to try and address several of them during my update. So hopefully that'll leave time for many of the other questions later. And I just want to confirm everybody can see my slides here. I will take nobody commenting that it is working. If anybody is not seeing it, please do pass a quick message. I see your S, great. So, I think a lot has actually improved since last month when I last updated you. Last month, I was quite concerned that we had seen a pretty steady increase of cases through the latter part of August and into early September. In early September, the province, of course, announced their vaccine certification rules in response to that. What we've actually seen since really the last month has actually been that cases have actually stopped increasing and have actually been on a gentle downwards trajectory. And I don't think any of us really expected that we would manage to get them down the way they've been going, but nonetheless, that is exactly what we've ended up seeing, which is certainly, I think, very good news. This is the Ontario case trend, and I'll just switch over here to the Niagara case trend. And you can see, again, we're seeing our cases come down. For those who might be following our website closely, we've had a few days of single-digit cases lately. And I think really about 10 days now where we've been in all but one day below 20 cases per day, which is a big difference from when we were in the 30s and 40 cases a day only just about 5 or 6 weeks ago. So there's been substantial, I think, improvement of the situation. It's hard to entirely know what is responsible for this. I think we've continued to get our vaccination rates higher. That's certainly helped. I do think that in late August, a lot of people were enjoying the summer. Many people were going to vacations, and particularly vacations overseas. And we're actually seeing a fair number of travel-related cases, and those haven't completely dried out, but they've definitely reduced in number. So I think that's probably part of it. But I actually think part of it is actually the vaccine certification rules that the province has brought in. Whenever we see something in society that could lead to increased transmission or decreased transmission, it's usually about a 2 to 3 week gap before we see the impact on that. And I'll just show you some examples. So if we go back to last year around this time, we had Thanksgiving, usually 2 to 3 week period. After that, you'd see a bump in cases if there was a lot of Thanksgiving parties, a lot of social interaction around Thanksgiving time. So I'll just draw in a 3 week window here that starts with Thanksgiving and takes us to about 3 weeks out. So Thanksgiving was around here at a time when cases are flat. And you can see when we came out of that 3 week period, we were seeing an upswing in cases. And that was almost certainly due to all of the social interaction that occurred over Thanksgiving. It created opportunities for infection to spread. And after we went through that period where it takes a few days for infection to build up in a person, few days for people to go get tested before it shows up in our data, we are definitely seeing that upward swing. On the flip side, in December, we're seeing cases go up and up and up. And on December 26th, I believe, the province instituted the lockdown at that point. And you can see, if we start, at where the lockdown was just began, and we go about 3 weeks out, you actually see that the impact of that lockdown is that we started to see our cases come back down. So if we go to the last month, December 22nd is when the vaccine certification rules came in. And you can see we sort of exit that with this downward trajectory in cases. And I think that we're really seeing the impact right now on vaccine certification to access some of these higher risk public settings. And that's really driving our cases down because it's actually stopped some of the highest risk opportunities for infection to spread in our community. And I know a lot of the businesses who may be watching here are impacted by that rule, but I hope this is really positive reinforcement that the unfortunate hard work that it takes to do that and perhaps some unhappy people, the outcome is that actually we're driving cases down and we're making it much more likely that there's not going to be any further business shutdowns because we're actually slowing and almost stopping the spread in those settings. And so I think that's certainly some good news. And I think that's probably a big part that explains why we're seeing our cases come down. Of course, if cases are coming down, that means there's fewer people who will get serious illness and be hospitalized. And we can see in Ontario, we're also seeing a gentle downward trend in our hospital numbers and even in our ICU admissions. It's a little less obvious, and these don't tend to come down as quickly as hospital admissions, just because when someone's admitted to an ICU, it's often several weeks before they can be discharged. But we're definitely not seeing it going up, and it is slightly trending downwards. Last month, when I spoke with you, I talked a lot about what we are seeing in Alberta. And Alberta, of course, took a very different approach than Ontario did with COVID-19. They pretty much lifted all of the preventive measures in early July. And 3 weeks out from that, in late July, they started to see their cases go up. And those cases, unfortunately, kept going up. And with more cases, that meant more people were being hospitalized, more people are ending up in the ICU. And this is a situation of what we find in Alberta right now, where these represent the orange is the people hospitalized and the pink here is the ICU numbers. And this is where Alberta still is. They've, of course, brought in some more measures earlier this month to start to address what they're seeing. And actually, I think it was last month they brought in those. Unfortunately, they have stopped the bleeding and they've stopped the numbers increasing. But you can see where they are is that their hospital numbers are still higher than it's been in either the second or third wave, or really at any point during this pandemic. And I think that really reflects how much danger that was out there and how much we managed to actually avoid that in Ontario by being a lot more careful to make sure we didn't see that kind of increase. Some of the headlines that I'm still seeing out of Alberta with those high hospitalization numbers are things like this, where their children's hospital is sadly seeing more children needing to be hospitalized for COVID-19, which is, quite tragic. Because their hospitals are so overwhelmed, there's a lot of work going into how do they triage care. So when they run out of beds, who is the person who's going to get the hospital bed and get the hospital treatment? And their actually triage plan initially involved actually triaging children. And understandably, I think there's quite the public outcry from that. And so they've adjusted their triage plan so that children always get a hospital bed now. But I think the very fact that they were even thinking about that just, I think, illustrates how much of a challenge that they have found themselves in with the cases being out of control there as a result of not really taking COVID seriously over the last few months. And if we go take a look at average deaths that they're seeing, I'm going to compare Alberta, Saskatchewan, a very similar province that kind of declared an end to the pandemic prematurely. You can see both of them have a relatively lower vaccination uptake than we have here in Ontario. And if we see what we're seeing in terms of deaths from COVID-19, I'll first start off with the Canadian average. So this is the average of what we're seeing in Canada. If we take a look here at Alberta, you can see how much more frequently people are sadly dying in Alberta from COVID-19. And I think that's a direct consequence to not continuing to take precautions to prevent COVID-19 and not really making sure they got their vaccine numbers as high as we have at the Canadian average or in Ontario. Saskatchewan, similar to Alberta, didn't take COVID very seriously through the summer, and they're seeing actually the highest deaths of any province in the country. And then when we take a look here at us in Ontario, you can see our deaths are half the Canadian average. and far, far lower, many times lower than on Alberta or Saskatchewan. And that's, I think, really the dividend we're getting from all the hard work we're doing to continue to manage COVID-19. Just want to show you an international example here, the UK, US, and Canada. You can see different vaccine uptakes across us here. The UK used to be one of the world leaders in vaccine uptake, and you can see in Canada we've overtaken them. And both the US and the UK really dropped their COVID precautions over the summer. Some parts of the US are now readopting them, places like California, for example, but you've no doubt seen news stories in the US where many parts of the country also hell-bent against any kind of COVID precautions and are actually taking active steps to stop, for example, schools from having people masked in school, etc. What we see here is that if this is what the UK is seeing in terms of their deaths, it's fortunately not nearly as high as their first or their second wave, and that's probably because of vaccination. This is what the US is seeing, and you can see their deaths have been much higher. And then this is us here in Canada, where we have a little bit of higher vaccination rate, and of course we've been doing things to continue to keep COVID under control, and this is where we are. And as I showed you on the previous graph, Ontario is doing about half of what the Canadian average is. So we would be down there. And so I think, another real example of how making sure we continue to take COVID seriously, a lot of lives are being saved in our country thanks to that. And I think a lot of that is, of course, through the hard work of a lot of businesses here who continue to enforce masking, who are checking for vaccine status, screening people as they enter the workplace, screening customers who enter, and really making sure everybody is staying safe. So these are the current vaccination numbers, and this is the entire population. And you may remember I used to have talked in the past that national modeling showed that once we got to about 75% of uptake of vaccination, we get to a stage where it was unlikely we would have so many cases we'd overwhelm our hospital system and start to see our hospitals overwhelmed. And that would really put us in a place where lockdowns would likely be a thing of the past. And you can see we're very close to that 75% now. Places like Alberta, which I showed in the previous slide, were around 64%, so they're not quite there. This was how that looked. This is looking at just eligible people. So 83% translates to about 75% of the entire population once we add children as well. And you can see if we're short of that 83% mark, we would see all of these different gray lines here are different scenarios of what might happen with hospitalization. And a lot of them would exceed the national capacity for hospitalizations. Whereas once we get to that 83% of eligible people or 75% of the whole population fully vaccinated, we start to have very few scenarios where we might exceed that. The most recent modeling is a little bit different. This is, again, similar to what I just showed you previously, where that dark line, which is the average scenario, is much lower than that dotted line. It's starting to show some scenarios where even with that level of vaccination, we might exceed the hospital capacity. And that's really because what's happened in the Western provinces, and the Western provinces could potentially drive us to exceed the hospital capacity overall. And what they show, though, is that if all provinces go back to practicing some preventive measures, plus having a vaccination outtake, we actually start to see the hospital numbers in these different scenarios a lot lower. And it's possible you might exceed the hospital capacity around now, but longer term, that's not going to happen. And I think this is really a message about the Western provinces needing to put those measures back in place similar to Ontario, so we can then see our hospitalization numbers come very much back into control. So I think what we're doing in Ontario is absolutely protecting our hospital system, and it's saving lives. But I think the other important thing, of course, it's doing is it's protecting our economy. And so I talked to you about what the UK and the US are seeing, and these are some of the headlines that I've seen. In the UK, they saw their economy grow a little bit in August, undershooting expectations, and they actually saw their economy decline in July. And a big part of that is, of course, there's global supply chain issues, which is part of this concern. But part of the issue is that people don't feel safe with seeing so many cases, so many people dying of COVID-19. They're not feeling comfortable going out and about, going shopping, using recreational facilities, all of that. And so there is less demand in their economy, and that's meaning they're not managing to meet their growth. If we look at the United States, they show another aspect of this, where people who are unemployed aren't actually going back to work because they feel unsafe to go back to work with infection spreading so much, and workplaces not taking measures to make sure that they're protected. And we can see actually here, an alarming number of women stop working because women don't feel safe sending their kids to school and to childcare when COVID-19 is spreading so much and they're having so many outbreaks, and they're choosing to leave the workforce to make sure their kids are safe and educated at home. And the impact is, of course, the US economy isn't doing as well as it could. The flip side to the UK and the US story is, of course, what the headlines we're seeing in Canada, where we had massive job gains. We've got employment back to pre-pandemic levels. Things are going a lot better here. And I think that's a direct consequence that we have COVID-19 under control. So the public feels confident resuming, getting back to pretty close to normal life. The businesses are able to get workers to the extent they can, and they're able to resume a lot of their operations. And we're really seeing, some of the economic recovery. Obviously, it's not done, but there's much more to go. And so the message I'm really taking here is that as long as we keep COVID-19 under control, of course, people's lives are going to be saved. Our hospitals are going to be able to function and catch up with all those surgeries and procedures that have been missed. And of course, our economy is going to be able to continue making a recovery. And so our goal is to make sure we're able to continue to keep things under control, allow all those things to happen. And of course, the other part of that is of keeping schools open. So we're very focused right now on making sure we identify where are the pockets of spread in our community to make sure we can try and address that. And I've shown in past months where we are seeing our outbreaks, and really over the last month and a half, this is where we have seen outbreaks in our community. And I think what's notable, particularly for this audience, is that one of the biggest parts of this pie is the workplaces here, workplace outbreaks. I've talked about the food services sector here. You can see that's another relatively larger piece of the pie. These food service outbreaks have overwhelmingly been workplace outbreaks. And I'll say actually since the vaccine certification rules came in and patrons of restaurants and bars, etc., have to all be fully vaccinated, we have seen no transmission amongst patrons there. All the transmission now is amongst employees. So these food service outbreaks are effectively just more workplace outbreaks. And a common denominator when we see spread in a workplace is usually there's a lower vaccine uptake. And so there's a lot of unvaccinated workers, which allows an outbreak to take place. Secondarily, we sometimes see some of the other preventive measures maybe not be fully implemented. And so we did a few media releases last month around workplaces and making workplaces safer, hoping that people will take that guidance, be able to implement in their workplace, and we can see these two bits of the pie come down. The other part of this pie that probably jumps out at you, of course, is this here, which is education sector outbreaks. And I'd say that's probably where our biggest priority is right now in public health, because we particularly see schools as a very vulnerable place. If we're thinking infections and outbreaks happen amongst unvaccinated people, our biggest congregation of unvaccinated people are actually elementary schools, where you have children under 12 years of age who just can't get vaccinated yet. There's not an approved vaccine. And of course, in schools, there's lots of them, possibly hundreds in any school. They're all going to interact through their different team-based learning activities. They're going to have phys ed classes. Children, of course, are going to play together during recesses, and that's going to create opportunities for infection to spread. And that remains, I think, one area where there could be a lot of risk for infection spreading. And as much as we want to try and limit that so we can really keep schools open and allow children to have a good learning opportunity. I mentioned we particularly see that 6 to 11-year age group as being a particularly high-risk group where infection could spread. And when we're looking at other jurisdictions, we're definitely seeing some of that. So this is Ontario data put out by the Science Table, and they're showing what are we seeing in terms of different age groups and cases. And you can see this blue line is the one that's kind of picking up ahead of the rest. And that's, of course, that 5 to 11-year age group where you have everybody is unvaccinated because sadly they can't be vaccinated. And they're back in school, they're back in activities, and that's allowing infection to start spreading. If we're looking at the data coming out of England here, you can see, the lines are, flat, sometimes going down, maybe going up a little. Where it's really going up is age 7 to 11, which is, again, that youngest school age group where they can't be vaccinated. So when we look in Niagara, we're very much looking to see that pattern. And this gray color here in this graph is really going to be across these younger age groups where we would potentially see that showing up in terms of spread within schools. And if we actually draw in the lines here of what we're seeing across our different age groups, you can actually see the gray line is here that's actually holding pretty similar to a lot of those other age groups. It's actually this 18 to 24 age group, which is leading the rest. The school children right now are actually remaining very much in the pack of the rest. And so I think we're having success right now at actually limiting the spread amongst that school age group. And that's partly why I think we have relatively few school cases right now. I think we have, I think it's 6 or 7 children associated with school right now who are an active case. Obviously, they're isolated along with many of their classmates. And for the most part, the rest of the schools are all able to operate. And I think that's certainly good news, and hopefully something will be able to continue. And as long as we keep cases down, that's going to help. All that being said, schools have been pretty impacted by the return to school so far. And so if we take a look at what our numbers look like through to the middle of last week, we've had a total of 150 cases linked to school. Now, linked to school doesn't mean the spread occurred in the school. It means it could have been they got infected outside the school, but they happened to show up in school one day when they could have transmitted infection to others. So 150 instances where infection could be spreading within the school, but not necessarily that it did. So that's a reasonable number of cases. Of course, you're in a school with a teacher and lots of classmates who could potentially be put at risk. And so when we look at the contacts for that, about these 150 cases, about 15% are cases, those 150 cases turn into 2,300 plus contacts who are put at risk of infection spreading. So that's a very large number, and it's a large number of people that we need to follow up with public health every time a case presents in school. So schools are quite a lot of work to keep them safe right now. We've had 65 schools that have at some point had one of these cases, either an infection spread within the school or more often someone who was infected outside of school showed up to school when they could have been infectious. And we've had a total of 11 school outbreaks where we've actually seen spread occurring within the school. So, these numbers aren't staggering, but they are relatively large. And there's a lot of work to make sure we identify these contacts and isolate them and stop this chains of transmission. When we look at a breakdown of where the school cases are, you can see it's overwhelmingly in elementary school, which obviously makes sense. That's where the 5 to 11 age group who can't yet be vaccinated is. And so we're seeing most of our cases in the part of the school system where we have the unvaccinated, or at least the largest group of unvaccinated students who can't yet be vaccinated. Likewise, if we're looking at contacts, the cases are in elementary schools and our contacts are likewise in elementary schools. And if we're looking at who within the schools is actually getting COVID-19, it's overwhelmingly the students, because the students have the lowest vaccination uptake, and if they're under 12 years of age, they're not vaccinated. We're of course seeing some staff getting sick, but it's overwhelmingly on students. So we're paying very close attention to that, and we want to try and address what is causing infections to come into schools. And if we take a look at where is the transmission happening that leads to stool cases, you can see almost half of that transmission is actually happening in the child's own home. A family member, a parent, a grandparent, someone who visits the home brings infection in, and unfortunately the child gets sick and ends up bringing that infection potentially into school. Sometimes children may visit the home of a friend, and that might be where they're infected. And then there's a smattering of others. Of course, some infection is spreading within the school, but I think a key message here is that most infection is actually arising outside of the school. And the number one thing we can do to make sure we keep schools safe and children safe when they go to school is to actually make sure everybody in the home and everybody the child may interact with and visit is fully vaccinated, because that creates that protective cocoon for children where nobody can get sick and spread infection to them. If we look at, not just the setting, in the home, but who is the actual person who transmitted infection to them, it's, not unsurprisingly, if it's in the home the infection is happening, it's a member of the household spreading infection. Other members of the family visiting is significant, friends visiting significant, others within the school or childcare where they might be going after school is also important. But again, the household, the friends, the family the child interacts with, that's where a majority of infections for children come from. And that's where we really want to make sure we get vaccination rates up to keep those children safe. And of course, in turn, keep schools safe and open throughout the school year. Now, I've talked a bit about the vaccination coverage, and I'll just show you what that looks like on this graph. So these are the first doses, and then these green are people who got second doses. And you can see we have very high coverage in our elderly group. In the more middle-aged group, it's sort of in the middle. And then the lowest vaccine uptake is actually in this 18 to 29-year age group. And as I showed you earlier, the 18 to 24 subgroup is actually where we're seeing the highest proportion of cases. And it's probably a direct consequence that their vaccine uptake isn't as high. We're of course trying to get this group vaccinated so we can keep the older grades in elementary school and our secondary school safe, and we're making progress. We're almost at 70% of them fully vaccinated. And I see this as really being the big area where if we can get more of these two groups vaccinated, that's going to make a big impact going forward in terms of actually slowing the spread of this pandemic and really ensuring we keep cases low and we're able to keep everything open and continue with our recovery from this pandemic where we are right now. Obviously, we want to do a little bit more, of course, to get these vaccinations number higher as well amongst this next group who's more around 80% and not quite up to the 90% and higher that our eldest groups are. Now, these are first and second doses, and there's one question submitted around third doses and what is the role of third doses. And particularly if you look at the United States, they've decided to roll out third doses to elderly persons. And I'd say the first thing to keep in mind is, of course, most of our infection is in unvaccinated people. It's not vaccinated people who are getting sick. And so doubling down to vaccinate our elderly who pretty much all have 2 doses already is perhaps not going to do a lot to actually reduce the spread of infection. And I'll just put another age graph here where I'm going to look at, these 5 different age groups. So, this is our under 20 group, the 20 to 39 group, the 40 to 59 group. And now we'll get into the 60 to 79 and 80 plus groups where there's some talk of should there be third doses done. So that is your 60 to 79 group, lower than the others. And then that's your 80 plus group, which is also lower than others. And let me just zoom in on that last part of the graph there so we can see what that looks like. So this is the green bar, that's the 60 to 79 age group. And then that's the 80 plus group, which is the purple. And you can see that those elderly groups where third doses are being done by the US and some other countries, including Israel, are actually where we're seeing the fewest cases. And I very much believe that it's a strategic error to go do third doses for this population right now, because this is not where people are getting infected. People are getting infected in these younger age groups where they don't have first and second doses. And what's really going to slow the pandemic and make sure we keep it under control, I think, is getting these people a first and second dose so they come down and have much lower infections. There's going to be very limited returns if you add extra vaccines onto the group who's already pretty highly vaccinated. And there's going to be opportunity cost. If you're busy trying to vaccinate this group, you're ignoring this group with much higher spread, and you're not spending that time to get their vaccine numbers up. And I think countries like the US and Israel, who are really focused on third doses with these populations, are making a big strategic error because they're taking their eye off where they should be focused and vaccinating the people who are unvaccinated, who are actually leading to the spread of the pandemic. And of course, secondarily, anytime we are using more vaccine here in North America, it means the rest of the world, where much of the world does not yet have even a first dose, they're seeing COVID-19 spreading uncontrollably, and they're going to see a lot of deaths that could be prevented if we didn't use that vaccine and we let the other countries start to get a hold of it. As well, we're going to see possibly new variants emerge, which could throw a wrench in our pandemic recovery. And if they're able to vaccinate their populations, that's going to save more lives, and it's going to prevent variants that couldn't come and harm us. And we need to just keep our focus on vaccinating the people who are actually spreading COVID-19. And, people who are, in these older age groups where unfortunately, sometimes even when fully vaccinated, they may occasionally still get COVID-19. What we're seeing is that they're not necessarily getting very severe illness. So if you are unvaccinated, your risk is 10 times higher than someone who's fully vaccinated. And this is national statistics. And so by getting those 2 doses of vaccine, you've brought your risk all the way down to 1/10 of what it was. A third dose, how much more gains is it going to make? There's going to be diminishing returns. And so I really don't think it makes sense when you have a group of people out here who are the ones spreading the pandemic with all this risk you could reduce if you got them their third dose. And if you're looking at hospitalizations, it's a 36-fold difference if you're fully vaccinated versus unvaccinated. So even those unfortunate few who are sadly still getting breakthrough infections, they're still just getting colds for the most part. They're very unlikely getting severely ill, being hospitalized, ending up in ICU, or battling for their life. And for that reason, I don't think third doses is really the way for us to go. I really think our focus needs to fully stay focused on first and second doses. And then in a couple months, when we hopefully have a vaccine for that 5 to 11 page population, we can start to focus on them as well. And really leave third doses for another day when maybe we've finished first and second doses for pretty much everybody. We've got the rest of the world vaccinated. We can then start looking up, to polish up and maybe address that last little bit of risk that we have. So with that, I'll stop there and I'll turn it over to you, Mishka, to moderate the questions.
Thank you so very much for the update. It's always greatly appreciated. And I noticed that each month when you provide the update, you do actually address a lot of the questions that have come forward and have been provided to us in advance. So we really appreciate it. We have a couple of audience questions, which is always lovely to see. And a couple of people have raised their hands. But I was wondering if I take the liberty of just getting 2 or 3 questions in ahead of time. And it's only because a high number of people have asked the same question. And first of all, we're pleased to see the numbers and the direction that the numbers are going in. And I think it speaks to everyone's efforts, your effort, your department's efforts, the health sector, but also the greater community. And that is always wonderful to see. With that, it does create some confidence within all of us. And so there is a question that has come forward and that has come up a couple of times over the last couple of months. And that is looking at some of the guidelines that have been put in place and the hope and optimism that some of it will be lifted. So one particular question that has come in from a couple of people has to do with the vaccine certification. And if they could ask you and saying like, how long will it be in place, such a structure be in place? When can people, individuals and businesses hope for it to be lifted?
Yeah, so ultimately it's going to be the provincial government that decides this. So I don't know what their thinking exactly is. The sense I get, which I would support, is that it's probably going to last through the winter and spring. And it probably will be closer to next summer when we finally lift it. I think that's going to give us the opportunity to hopefully keep lifting restrictions. We just had an announcement around capacity limits in sporting facilities. There's a potential for capacity limits in restaurants and others to be lifted. And I think doing those sorts of changes is made safer by the fact that we have the vaccine certification in place. And we want to make sure we get through the winter where it's going to be cooler, people are going to move more indoors. We're going to have US Thanksgiving, Halloween, Christmas, where people are going to interact. There's going to be a lot of risk of infection spreading, and we want to try and limit that as much as possible and make sure we get through the winter and spring. And through that time, we'll get vaccines for younger age groups so we can vaccinate them. And we'll be a lot safer come next spring, summer. And I think that's probably where we look at those vaccine certification requirements lifted.
Perfect. A related question, again, about lifting some of the guidelines that are in place. This has come forward from one of our participants today. And Tracy, they're asking, do we foresee or do you foresee the elimination of the COVID test when returning to Canada from the United States? Again, it's looking at it and saying if we're trending in the right direction, at what time can we expect that?
Yeah, again, this is international discussions with the Canadian government. I don't know exactly what they would be thinking. My sense is it's probably not going to go away anytime soon. What's happening is that if you're fully vaccinated, you don't need to quarantine. So you come back from the border, you don't need to quarantine, you just go back to your normal life. But we do that test just to make sure if you did get infection, we at least pick that up and stop any further spread. And I will say we are still picking up infections from people who do travel internationally. We're on averaging about 1 case of international travel infections a day. So I do think that test is valuable. It is picking up infections. So I think it probably will continue for the foreseeable future, at least until a time where the US maybe is like us, has much lower spread of infections, and we can think that the risk is a lot lower.
Okay, thank you. But I think when I look at the question, and especially because those have come in from a number of people, I think it speaks to people's wish and hope for actually the return to some level of normality in life that we all are familiar to. And so I really do appreciate the questions very much. I wanted to also mention something, and that was related to actually that the transmission is highest at home for school-age kids, and we have Halloween coming up. And Halloween last year looked significantly differently than what we maybe are anticipating in 12 days from now. Can you give us an overview, like a little bit on your take of what to expect or how to maybe stay safe when it comes to Halloween, and especially to younger kids?
Sure. So I'll maybe start with the younger kids and the trick-or-treating, which is, I think, what they are most looking forward to. And I think that can actually proceed with just some basic precautions put in place. So, ideally have them go trick-or-treating with groups of friends that they're already interacting with often. Hopefully it's, their best friends, and have a relatively smaller group rather than a big crowd. So that'll limit the risk. When you get to every door, ring the doorbell and take a few steps back. So you're keeping that 6 feet of distance from whoever is at the door. If you can wear a mask and incorporate a mask into part of your costume, that's of course going to keep you safe as well. And just use hand sanitizer often. You're going to be handing out candy to kids. You're going to be receiving candy if you are a child. Just use hand sanitizer once in a while. That's an easy, safe step that is going to reduce your risk. And if you're doing that, I think you can go off and have trick-or-treating and enjoy that part of the the Halloween tradition. The part I worry a bit more about is maybe what we as adults would do, which is Halloween parties. And that's the kind of social interaction where I do worry, where there's a lot of intermingling amongst people and you could see further spread. And what I'd advise is that if you're going to have a Halloween party, it should be limited to just people who are fully vaccinated, especially if you're going to a restaurant, that's going to be basically required by the vaccine certification rules. But if you're having it privately, have it just with other people who are fully vaccinated. If you're able to move it outdoors, and we'll see what the weather's like, that of course makes things safer. If it's indoors, spread everybody out. And then remember, there are capacity rules the province has that a private gathering can only be 25 people indoors or 100 people outdoors, and try to follow those. But if you do those, you can make those parties, I think, relatively safe. I think trick-or-treating, though, is the easy one, where I think that's relatively low risk as long as you're just taking a few basic precautions.
Okay, it's good to hear. And it's good to hear a year later that this looks quite different for a lot of, especially the younger population that is so eager to take part in it. I would like to bring in some of our participants, and we have Brenda West, who has actually raised her hand. And actually, Brenda, if we can unmute you, then I think it gives you a chance to ask the question live. And I think you are live right now.
Hi, I just had a quick question. How long are you protected from COVID with 2 vaccines without the booster shot?
Yeah, it's a very good question, and that means that we don't entirely know yet. What we are seeing in some countries like the US and Israel is that maybe after about 8 months, your immunity goes down a little bit if you're older, and that's generally over 6 years of age. But that seems to only be limited to people who got both Pfizer doses. If you got mixed Pfizer Moderna or 2 Moderna doses, or an AstraZeneca and Moderna, you don't really see that drop off around 8 months. And it's really limited to that older age group where it drops a little bit. So you're still protected, you're just not as protected. What's interesting though, when you look at a country like the UK, which spaced that first and second dose out 3 months, or in Canada where we spaced it 3 to 4 months, we're not seeing that same decrease after the 8 months that those countries are. And there's some thought that actually what we did in Canada, where we spaced out that first and second dose, is actually going to probably lead to us having longer lasting immunity with just those doses, and actually make a booster something that we don't need for much longer, or perhaps even never. So I think we're only going to find out with the benefit of more time to see what happens, how long that protection lasts. It does last. It maybe decreases a little bit in older people, mostly if you got 2 Pfizer doses, and if you got your doses just 3 weeks apart. If you spaced out those doses as we did in Canada, or if you got some combination other than 2 Pfizer doses, you seem to have protection that lasts longer.
Thank you very much. This is a question from Kelly, and they're asking, I came in a bit late to this, but wonder if flu shots have been discussed, and are they recommended in the workplace? And if so, what is the timeline? And that is actually an interesting question too, because there's a lot of awareness being created right now about individuals getting their flu shot.
Yeah. So the Ontario government actually did their big announcement this morning that flu shots are now available for everybody. So anybody can go see their family doctor, go to a pharmacy and start getting their flu shots. I definitely recommend getting a flu shot, and I think it makes sense for people in the workplace to get a flu shot. Number one reason is that we've gone a year without really getting the flu, and we haven't given our immune system the exercise of really facing that virus. So our immune systems may actually not be as ready to face off with the flu virus this year. So getting that vaccine is going to help us stay healthy. Second thing is that the symptoms you get with the flu is actually very similar to the symptoms you get with COVID-19. And if you get those symptoms, you aren't supposed to be allowed to go to work. You need to stay home, isolate, get tested. So you could actually end up with influenza, you could have the flu, but it looks like it might be COVID. You have to stay home, you have to go get tested. You're not at work, able to contribute to the workplace operating, which is disruptive to the workplace. And of course, it's disruptive to you. You have to be homesick and not able to go to work and be around your work colleagues. So I think that's the second reason you want to get the flu shot, to really take that away so businesses don't get disrupted with people having to isolate, and people don't get their lives disrupted by getting symptoms which look like they might be COVID, aren't actually COVID, they're flu, but nonetheless they have to isolate because we can't be sure until someone gets tested. And then finally, flu actually leads to a fair number of hospitalizations in most years. It actually stretches our healthcare system pretty much to its max. In Ontario, we see about 1,300 people die of influenza every year. So if we get vaccinated, we are hopefully going to protect our healthcare system. We're going to prevent influenza from spreading to vulnerable people, who include elderly people, but also children who are more likely to die from influenza. And we'll basically just keep everybody safer. So for those reasons, I'd strongly recommend everybody does get their flu shot. It's, safe, it's easy, it's, free. No reason why we shouldn't get it.
All right, thank you very much. This is a business-related question, and that is related or comes from restaurants and bars and food service places. And they are wondering, naturally, they would have liked to raise the capacity limits for their establishments for all the right reasons of why they do and why they want to. What do you think need to be some of the indicators that it's safe, or that the provincial government is moving in that direction?
Yeah, what I'd say really is that we just done lifting the capacity limits for sports. I'd want to wait a few weeks now just to make sure we don't see anything coming out of that. And then we'll be ready to take the next step of lifting whatever the next restrictions the province decide on, which may well be, and hopefully for our food service industry, end up being the capacity limits in restaurants. I think vaccine certification, as I said, basically is meant we're not seeing spread amongst patrons. So there is hopefully some opportunity there. We can lift some of the other measures that they have to put in place, and the capacity limits make sense, I think, as one that hopefully allows them to have more business. Something that I don't know if the province is going to require, but I would strongly recommend is that you put in place measures to get all of your employees vaccinated as well. The highest risk inside a food premise is the people sitting around at a table together. They're facing each other. They're not wearing masks while they're eating. They're obviously not going to be 2 meters apart because tables aren't 2 meters wide. That's where the highest risk is. And we seem to really address that by requiring that all of those people are now fully vaccinated. The second biggest risk is actually the server who's going to come within 2 meters of you to serve you. And if we can have all of them vaccinated and all the staff vaccinated, I think that gives, basically the maximum level of security for everybody there. So we start to move, tables together and bring other people closer together. We're moving more fully vaccinated people together. We basically have everybody in this restaurant is fully vaccinated and everybody's going to be safe.
There are, Tom, I appreciate it. There are two questions kind of related to it, or at least kind of at arm's length. One of them is, I'm always being asked after the seminar, Dr. Hirji, when you speak about the workplace outbreak being at 28%, the education outbreak being at 37% between September to October 15th, what does 28% represent? What does 37% represent in number of workplaces or employees impacted by it? Because it's meaningful to others to have a better understanding on that.
Yeah. So the number of workplaces that 28 represents is in the high teens. I don't remember the exact number, but we're looking on the order of 17, 18, 19 or so workplaces. Each of those workplaces is kind of varied in size. We've had a few workplace outbreaks that are only about 3 or 4. We've also got ones that are 15, 16 people, and that partly correlates with how large the workplace is. but not necessarily. We've had, even relatively small food premises that have had, 8, 9 people unfortunately getting sick and unfortunately having to actually stop operating because they've lost so many staff who've had to be home isolating.
Yeah, that makes sense. Now, this is a question that was interesting. Some of the businesses have asked us, and those are businesses which are not mandated to check the vaccine status of their patrons or customers. And they're asking if they would be allowed to check the vaccine status of patrons, even though they do not fall in that industry that is legally required to do so. And they're wondering if you can say whether this is possible or advisable, and what should a business be aware of before contemplating this step?
Yeah, so I would definitely be supportive of this. I think if you have that requirement, it keeps the employees safe, it keeps your customers safe. It's just good, I think, for everybody, and it's going to limit disruption. As I understand, there's nothing preventing this. I'm not a lawyer, so you might want to talk to someone who's a lawyer just to confirm, but I don't think there's anything that prevents you from doing this. The biggest risk, I think, in terms of here is actually just recording that information. You don't want to be recording personal health information. So the way to record anything would be that is okay to enter the workplace, not okay to enter the workplace. And that doesn't get into your recording details if they're vaccinated or not, or if they had a medical exemption or not, or whatever it might be. You're just verifying that. The province has, of course, created the Verify Ontario app, which you can download on either a smartphone from Samsung, I think Android or Apple, and you can use that to actually scan the barcode in the new enhanced vaccine certification receipts. So that actually makes it really easy for any business. They just need to download that app onto a phone and scan that barcode to anybody entering, and it'll tell you, is it okay for this person to enter the workplace or not? So I think any business hopefully can do it with relative ease. Obviously, you do need to have someone actually checking for that, which is some burden. Just make sure you're not recording any personal health information. I think you're okay to go.
Okay, thank you. I appreciate that. And so do the business that actually have asked it. Also, since the last time we talked, the US-Canada border, now land, sea, and air, is opening to fully vaccinated travelers on November the 8th. News that many Canadians have been waiting for, especially people with family and relatives and friends in the United States. There is some confusion still among people over if people who receive doses of 2 different vaccines will be considered to be fully vaccinated by the United States. And the other one is around the second part of the question is the requirement for a negative COVID-19 test result by when they re-enter Canada. And I was wondering if you could elaborate on that for our audience.
Sure. So as I understand it, actually, the US doesn't have any vaccination requirement to cross the border, really. I think that comes in place in January. So I think actually in the short term, you wouldn't actually need to show proof of vaccination to go into the US. It's more you have to show that proof when coming back into Canada. And of course, the test is more required by Canada. What it sounds like the US is moving in the direction of is to recognize the mixed doses of vaccine. So I fully anticipate by November 8th, there'll be an agreement with the Canadian and the US government that anybody who's considered fully vaccinated in Canada will be considered fully vaccinated in the US, and that won't be an issue. I don't think there's a testing requirement into the US. You'll need that test to come back into Canada. So we'll have to see if the federal government decides they want to make a change to that or not. As I indicated earlier, I think it's a good measure to keep in place. If you're just crossing for a few hours, you could probably even get that test in Canada and just show it when you come back across the border. So you wouldn't necessarily have to pay the higher costs in the US side. The one thing I just want to add to this question is that while we're going to be allowed to cross to the US border, I would really caution crossing unless you have very important reasons to do so. And if you do, to make sure you practice lots of precautions. The US, when I look at Erie County and Niagara County, are 2 bordering counties, have 9.5 times and 11.5 times the spread of COVID-19 that we do. And I showed you that slide that your risk of COVID when you're vaccinated goes down about to 1/10. You're going to cross into the US where all of a sudden your risk is going to go back tenfold because there's 10 times more COVID around. And you're going to kind of balance out the benefit of the vaccine. And so I don't think it's a good time to be really traveling to the US. If you have extended family you need to see, go there, see your family, do that. Don't go shopping, don't do anything else to really try and limit your risk going forward. And hopefully in the coming months, the US will get their COVID situation more under control, become a lot safer for us to travel.
Okay, thank you very much. Appreciate that. There's another question that has come forward. So a couple of people who have asked that, and how much more likely it is that an unvaccinated person to transmit COVID than a vaccinated person. And I think there's been a lot of confusion around that aspect of it, but especially when we're talking about having more gatherings in our house, like we had around Thanksgiving, maybe how we're going to have around COVID, we might have a different sense of when it comes to that. And I was wondering if you can give us some clarity.
Sure. So I don't think we have great information on this yet. But as I showed you with my last slide, there's a tenfold difference in just getting COVID-19 if you're vaccinated versus unvaccinated. And the first requirement to be able to spread COVID-19 is you actually need to have COVID-19. So at least there's going to be a tenfold difference right there. Our belief in, the early evidence does show that if you are vaccinated, that virus, once it gets to you, doesn't really multiply enough to really be able to be as contagious. That's one of the reasons why you also don't get severe illness as much. And there's that 36-fold difference in terms of being hospitalized, because your immune system, while it doesn't stop the infection entirely, suppresses it very quickly. And for that same reason, we can expect it's going to suppress the virus very quickly and stop it from being able to spread. So I don't want to give a precise number, but at least tenfold less, and could be as high as even that 36-fold less that we see with hospitalizations.
Okay, thank you. There is a number of individuals who've asked the question, and that has been on the need to get continuously vaccinated. Even if we move the third vaccine shot or the booster shot to the side, and we're looking at in a year from now, do all the individuals who have had 2 vaccines, who have been fully vaccinated, is this something that we need to anticipate on an annual basis?
I don't think we know the answer to that yet. It's a maybe right now. We're going to have to see how well the immunity holds up over time. Part of what actually increases, boosts our immunity with vaccines is actually just coming in contact with the virus again. One thing we see with chickenpox, once you get immunity from chickenpox, if you happen to have someone you come in contact with chickenpox, that kind of boosts your immunity up, because your immune system gets an opportunity to fight off that virus, remember how to fight that virus, and that really has prevented the need from having any boosters. And so I think that'll actually be part of what happens. And if there's a small amount of COVID-19 that continues to go around, we're all fully vaccinated with 2 doses, so we're not really being hospitalized. That might actually turn out to be enough that we end up with good enough immunity that this is just another cold virus that's going around. And do we really need to get a booster shot to better protect us from the cold? Some people may well choose it, but maybe not everybody's going to. Or it might be that this is more like the influenza vaccine, where the immunity seems to wane over time, and we do need to get relatively frequent booster shots. Probably isn't going to end up being every year the way influenza virus is, because the COVID-19 vaccine seems to be a lot better. But it's possible that it could be like a tetanus vaccine, where every few years we need to get a booster. So I think we're only going to find that out over time.
Yep, makes sense. There's a question from one of our participants, and that was, we had often had dialogues about Section 22 in the past. I know most of it has been lifted. Any updates on that, or are you foreseeing any further Section 22 orders coming into place?
Yeah, not really seeing additional Section 22 orders coming in place. The one area where we might see some changes in restrictions would be in athletic facilities, and particularly around youth athletics. We've actually seen 2/3 of local public health agencies in the province put in some local rules around youth athletics. And so we're considering that right now. Haven't made any decisions on that, but we've sent out some feelers to see what thoughts are and how we can make sure that this is least impactful for all businesses and operators of those facilities. Aside from that, we're not looking at anything particularly new at this time. If we were to do new things, I think they would really be focused on requiring vaccinations in areas where we're seeing frequent outbreaks. And it wouldn't necessarily be restricting customers. It would just be, expanding vaccine certification requirements. As for the current Section 22 orders we have in place, our plan right now is to really sit with them and not make any changes. The province is, of course, taking steps to reopen. So we'll let that play out. And if they get to the end of that line and we're still seeing everything well under control, I think that would be the time where we start to lift the final restrictions, which are the local ones we've put in place.
Very good. A lot of employers are trying to accommodate employees by offering them flexibility when it comes about returning to work, when it comes to working remotely in other areas of it. So when we look at the statistics across Canada, Niagara is no exception to it. There's still a high number of us working remotely at this point and likely are planning to move forward to it. How necessary is it that actually people are continuing to work from home where possible versus actually ensuring that they're coming back to work?
Yeah, my feeling on this is it really depends on the employer and how important it is to have employees in the workplace. You know, there's some kinds of work where it's going to really be enhanced if you have people in the workplace. And I think then it makes sense to bring them back with an expectation that everybody is fully vaccinated, so you keep that workplace safe. I think to the extent we can reduce social interaction, which includes people in the workplace interacting with each other, that is helping us limit the spread of infection. So where a worker can do equivalent work from home, I think it's still good to facilitate them working from home for a little bit longer, at least through these winter and spring months as we get through hopefully the final end of the pandemic. But I think it really should be guided now by what are the business needs and not holding back the business needs. And where you do have people back in the workplace, I'd very strongly encourage a vaccine requirement to make sure that we keep that workplace safe then.
Yeah, and it's very interesting to see how more and more employers, even in Niagara, are putting in COVID vaccination actually mandates like we have never seen before. And we saw early on some bigger companies putting it in place, but we're now seeing actually workplaces of all sizes actually following suit on the same issue. We have 3 minutes to go. Any closing comments, Dr. Hirji, on this one?
You know, I think lots of good news. I am mindful there are some storm clouds on the horizon. We're heading to cooler weather. People are going to head indoors. There's going to be more social interaction from that. We haven't yet seen what the impact of Thanksgiving was. I showed last year there was a bump from that. So we'll see what plays out. I'm hoping it's not much, and hopefully people were fully vaccinated when they had their social gatherings. But if not, we could see a bump from that. Halloween, Christmas, US Thanksgiving, all of those might contribute. So I very much don't think we're out of the woods yet, but we're doing well right now. And I think a big part of that is actually thanks to everybody on this call by personally practicing those things that are keeping us safe, wearing masks, keeping distance, getting your vaccine, as well as for the businesses you work in or you operate, doing the things that keep the businesses safe. You know, screening employees for symptoms, you know, encouraging, supporting vaccination, maybe requiring it in some place, enforcing the masking in the workplace amongst customers coming to the workplace, enforcing the vaccine certification. All of that is really why we're seeing the success we're doing. And if we keep that up, I'm actually pretty optimistic we can actually see this through the spring and get to the point where we can actually step back from all of this. And I think it's pretty good. We have got most things pretty open. We're hopefully going to start lifting more and more measures. We just need to hold that line, continue to be vigilant, and we'll hopefully see the end of this pandemic in a way that's not too painful now.
Yeah, I have to say this is likely the most optimistic conversation you and I have had over the last 6 months, or at least one that actually gives us hope that we see an end to it, and that we even already are talking in terms knowing fully well that this is a very fluid situation that could quickly change with behavior, with new variants and other areas of it. I appreciate your commitment to all of this. I appreciate your time on behalf of all of our members in keeping us safe and keeping the lines of communication open. Thank you to our attendees today and to those ones who afterwards actually tune in as well. We really appreciate that you're listening to this recording, and we hope that the information is extremely helpful to you. If you need more resources or are looking for more information, please feel free to go to the Niagara Health website, or to go to our website at gncc.ca, where we have a list of information resources available to you to ensure that your patrons, your employees and your suppliers are safe, including yourself too. And on that note, thank you so very much, and I'm wishing everyone a wonderful afternoon.